So I think, Dr. Kessel, can you talk about the Women's Health Initiative and then just kind of how hormones a while ago were given and it was a very popular thing, and then it's kind of downfall because of the WHI, and then it's kind of a complicated, convoluted story, and it all kind of revolves around this one really bad study. So it takes a little bit to explain, but it's so important, and Dr. Kessel is the best at explaining this.
Maybe because it'll be interesting for me.
Yeah, and it has all the implications on why we do what we do now.
Okay.
Yeah.
Yeah, well, hormones were very, very popular initially for symptoms, but then for prevention. And they thought this would protect against hip fractures, which it does, but it would also be good for your heart. And that was a big driver, to be good for your heart. But see, despite its use, that study had never been done, okay? And
They were using all these hormones for preventative things.
Yeah.
But we really didn't have evidence for it.
Nobody had done that study. Okay.
Okay.
So that was the onset of the Women's Health Initiative.
Okay.
That was the first attempt to do a big study specifically to look at prevention. So they weren't even looking at symptoms.
Okay.
They were looking at, on the good side, did this prevent heart attacks? And on the bad side, did it increase breast cancer?
Got it.
So that was the starting point of the Women's Health Initiative, like close to $700 million study. It was a big effort on the part of the United States. And then when it was prematurely terminated, that landed like a bombshell.
Why was it prematurely terminated?
They had
Bad statistics.
They had a press release saying that the risks outweigh the benefits, and that was a press release by the NIH, a press conference.
Okay.
And then by the next morning, it was the cover of the Boston Globe, the New York Times. It was just everywhere.
And it ran from 1998 and then prematurely cut off in 2002.
Yeah.
So it stopped early.
Okay. And so, what were the findings or the premature findings that led to them stopping this study? Because there obviously must have been that people were having adverse effects, or they thought they were having adverse effects.
The actual trigger that stopped the study, because it was prearranged to be a trigger, was breast cancer rates.
Okay.
But then when papers were coming out, well, there are a couple of problems, including with the media, is not only was there increased breast cancer, but there was increased heart disease, whereas the initial hypothesis is it would prevent heart disease at an increase. But then the other big problem, which is also media, but partly the people who wrote the paper, is everything was presented in hazard ratios. So this doesn't work in the office. You're not going to start with a 30-minute discussion of what a hazard ratio is.
Yes.
And so when you're sitting with a patient.
Instead of I think risk, right?
I would say that even for physicians, right? I always tell people who do research that many of us, we're not statisticians.
Right.
We don't have a statistics background.
Right.
So even for me, even though I do research, I have to ask the statistician a lot of times, what exactly, can you just explain? And it is not easy to explain.
Right.
Or to grasp it sometimes.
And that was a gigantic problem, because what came out in the paper was hazard ratios, that there was a 30% increase in breast cancer. Okay?
Okay.
Well, if you did exactly what you're saying, and you took that 30% increase in breast cancer, which is flipping out all of our patients, right? And you switched it over to what you're saying, absolute attributable risks. Well, then what it was is, in the placebo, not taking hormones, there were 13 breast cancers per 10,000 women.
Okay.
And hormones was increasing that to 20 breast cancers per 10,000 women.
Okay.
So you are getting 6 or 7 more breast cancers, true, but that's per 10,000 women.
So it's not that,
Yeah, it's a small.
right?
So when
In the
you,
end.
so if you're in the office and someone's sitting there with dripping off,
See.
and you explain that 6 more breast cancers, they'll go, fine, I'll take my
Yeah.
chances.
Right?
Got it.